Hello again, everyone. Just wanted to start off and say thank you to everyone who's taken the time to watch, comment, subscribe. It really means the world to me, and I really truly appreciate it. My hope in all of this is to help somebody who may be facing this or a similar situation. I didn't find much on YouTube to watch when I was looking up mediastinal tumors, especially not teratomas, and I personally would have liked to have seen something for myself to prepare myself before this whole ordeal. And looking online, looking on YouTube, I just really didn't find anything. So my goal in this, maybe it encourages somebody, maybe it gives somebody hope. Maybe you have a family member that's going through or about to go through something similar to this. I hope that this can provide some perspective, some insight, what life is like inside the hospital, what life is like inside the ICU, what life is like, just when you're trying to support somebody. I hope that you're never in this situation. I hope that you never have anybody that is in this situation. But if that were to happen, hopefully something from one of these videos you find useful, or whatever the case may be. I hope it helps you, because there's no way that I endured all this pain and all this suffering and don't have a lesson from it, right? I want it to be a lesson for everyone. I want to share this with as many people as I possibly can. Again, just trying to help somebody. That's really what it's all about. By far, the question that I get most is, where am I now? Well, I'm at home, I'm back at work, I'm trying to get my life back to being as normal as possible, the way it was before surgery, before I found out about this tumor that was on my heart. I'm definitely not 100% yet. I still have a ton of physical pain, random emotions, like PTSD, and there's also, it's called PICS, P-I-C-S. It's like PTSD, it's post-intensive care syndrome. Definitely having struggles and bouts with those things, and I think a lot of that is because this all happened so quickly. We'll get into the diagnosis and how it all happened later on, but it happened so suddenly, and when you're in the hospital, you're just in, fight for your life kind of mode. So you're not really thinking about what bills are coming up, what appointments you may have, the car needs an oil change. Those things are not going through your mind, because you're just focused on pure survival and enduring and getting through what you're in at that moment. So now that I'm at home and I'm starting to kind of get back into the routine of things, yes, I still hurt. Yes, I still have all these things going on. But as I'm trying to get back into the routine of things, my mind's got a little bit more free time than it did when I was in the hospital. And I think that really contributes to some of these types of symptoms, like the PTSD. So again, if this is a situation that you're faced with, I really hope not, or a situation that a friend or family member is faced with, just be aware that it doesn't end when they leave the hospital. That's not even close to where it ends. For some people, their procedures, their surgeries, their recovery is fairly simple. And I don't mean to discredit that whatsoever. But there's definitely different levels of intensity and complexity. And I was pretty high at the top. So for me, leaving the hospital was a wonderful thing. I felt like I was finally going to get my life back. And yeah, of course, I'm disappointed that it's not there yet. It's been 8 months, like today, since my big surgery to remove the tumor. And I'm not there yet. And I feel like I should have been a long time ago. I started to get better, and then things progressively got worse. So just be prepared that it's not over when you leave the hospital. There's a lot of thoughts and emotions that come with it, so just be ready for that. So even though I'm starting to get back into what I would call kind of a normal routine, going to work, being a dad, being a husband, fixing things around the house. I definitely get frustrated by the constant pain, physical limitations. I can't carry in a pack of water from the grocery store. Right now, my lung capacity is about 50% of what it should be. My right lung is not really doing its thing. We don't know yet what that exactly is. I think it's scar tissue. That's my thought. The doctors are thinking that it's not really working because pain. And when it hurts to breathe, obviously, it's not something you cognitively do. It's not something you think about. Your body just reacts. So I'm not taking deep breaths. Whatever the case may be, it's incredibly frustrating. Personally, I've got a long road ahead. Constant follow-ups, CT scans, blood labs, you name it. I'm at the doctor quite a bit. And it's about an hour away, so that adds to the frustration as well. Trying to fit all these doctor's appointments in your normal busy schedule, leaving work early, coming home late, those things happen. I have a mass forming on my lung that wasn't there immediately after surgery. It was first noticed on my last CT scan about a month or so ago. So as of right now, we're going to just continue monitoring it. Could be scar tissue. Could be new tumor growth. We don't know, because they did have to leave some tumor on my heart, because I guess I'm not a surgeon, but I guess it's pretty difficult to take a knife to a beating heart, right? So there was a patch of tumor that they had to leave on my heart, because if they were to take the tumor completely off the heart, they would have had to rebuild one of my valves. I can't remember which one. Honestly, it doesn't matter. The way the surgeon described it was, if they rebuilt that valve, no big deal. But at minimum, they're probably going to have to rebuild it every 10 years. So he thought the risk was worth leaving this small patch of it. I guess it's about roughly the size of a postage stamp. Because again, if this is a malignant thing that's not going to regrow, theoretically it doesn't harm anything. We don't know. But this mass on my lung was not there previously. Now it's there. It's about 9 millimeters. I really hope and pray that it's not something that they need to go back in and do another VATS procedure where they, cut in between your ribs and go in there with all these robotic devices and biopsy, take it out. So there's definitely still, I'm not out of the woods yet, right? There's definitely more to the story to come. I don't know what's going to come. I'm just taking it day by day right now. What more can you do? Put your faith in God, and His will is His will, right? Obviously, I didn't want to endure any of the stuff that I went through, but I wouldn't change it, because it's changed me. It's changed my perspective on everything, and I'm not sitting here saying I'm better. I'm not going to say that everything's, sunshine and rainbows. It's not. I have a lot of hard days. Just talking about it, I get kind of emotional. I get worked up. There's so many thoughts. There's so many feelings, fears. What's to come? What could happen? What's it going to be like if I have to go into surgery again? I can't even imagine that right now. It's just so hard for me to even think of, considering how much pain I'm in now. So, not fun things to think about, right? Take it day by day, put your trust in God. But I want to say to everybody that's followed this story, I'm totally blown away by the amount of support, the amount of encouragement, the kind words from literally all over the world. Australia, New Zealand, the UK, the US, all parts of the US, everywhere. People have commented and shared their stories, and by all means, if you feel comfortable sharing, please do. It helps me feel like I'm not alone in this, because it's really difficult to relate how I feel, things that I think or have in my mind to somebody that's not been through this, right? So connecting with you all who have been in a similar situation, reading your stories through your comments, it helps me. It really does. I feel like, it gives me encouragement. It gives me hope. It gives me a different perspective. So I really appreciate those who have taken the time to share. And by all means, 10 years from now, if you're seeing this and you have something to say, please say it. Even if it's not something that helps me, you never know who's going to see it. And these are things that should be talked about, right? It's not an easy road, and I feel like so many people keep this type of stuff just hidden and secret, and they deal with it alone. You don't have to deal with it alone. It takes support from friends, family. You can't do it alone. You can't. So by all means, if you feel like you like to share, I personally love reading it. I really do. So please continue to do that. And yes, I know not everybody has many friends and family. I'm blessed. I really don't have any friends, so to speak. I really don't. I have my wife. She's my best friend. And I have my family and I have her family, and that her family's close by. They're a great support system, but again, it's hard to relate to people that haven't been through this type of stuff. They don't understand. And you can explain it all day long, but they don't know because they haven't been through it. So I understand not everybody has the same support system. You'll notice my little buddy here. This is our bearded dragon, Bowser, a pet, right? So sometimes I don't want to talk. Sometimes it's nice to just grab Bowser and have him sit with me. He doesn't complain. He doesn't ever, make a fuss. He just enjoys sitting with me. So I love it. Get yourself an animal. That helps. Friends, family, an animal, whatever it takes. You need a way to vent. You need a way to get your feelings out. There's so much more that I plan to share. My story's not done yet. It's filled with a lot of drama, twists and turns, pain, struggles, life lessons, again, that people don't talk about. How do you handle your bills? How do you handle the insurance companies? It's not fun. It's not easy. It's things that nobody talks about, but it's real and it has to happen. So thank you all so much for watching. It really means the world to me. I'm going to keep making these. If there's anything in particular you'd like to ask, please feel free. For the most part, I'm an open book. Obviously, there's some things that are personal, but for the most part, I feel that God's placed it on me to talk about it, to share my story. I've witnessed his miracles through this whole situation. And I am the absolute last person to deserve any blessings from God. But he's truly shown himself so many times in so many ways. Just absolute miracles. It's been amazing. So I really feel that he's placed it upon me to share. And I hope that it touches somebody one day. It helps somebody one day. That's the goal. And the more that you interact with the video, the more you like, the more you comment, the more people this reaches. Again, this has literally gone across the world. New Zealand, Australia, that's completely on the other side of the world. I have no idea how people over there have stumbled upon my videos, but I'm happy that they did. It's been really nice to talk to you all. I appreciate you watching. Take care. God bless. Thank you very much. See you soon. Say bye, Bowser. Bye. Thank you all. See you next time. God bless.